pollens all year long. So I moved to North Carolina, and I suffer from seasonal allergies. And then now I use HEPA filters in my office, in my bedroom, in the other area. My wife is here. We have 3 at home right now, and I have 2, one on the desk and the other one in my office. So that really helps me to, overcome those difficult 3 months in the spring in North Carolina. But what really motivated me to work on this thing was actually not because of my personal experience. I was not smart enough back 10 years ago to realize that HEPA filter can help me on that. But was really when I was in about 10 years ago, I started a program in China, Duke-sponsored campus over there. And that's the time you're probably going to see lots of air pollution sort of headline news, right? Beijing is here, whoa, you cannot see the sky. The China's Great Wall becomes Great Wall, that sort of thing. And I got there. People know that I do air pollution research, and then my in-laws, my friends, whatever, say, what can we do? This kind of air pollution. Tell me what can we do to be helpful, in terms of their health thing. So I said, I'm not going to do any other type of work in China with air pollution, but I would just do the intervention. And then I would say, what kind of things we're going to do? I think HEPA filter, the other technology I assessed, but I have to say that most convincing, most safe technology I would recommend to everybody, I'm personally using, is the high efficiency air particulate filters, which is the one that our friends here, you are using. And so I spent 5 years in China, did short-term trials. Very easy thing to do as a fine college students, right? Use this for a day to a week, and then measure some indicators that can be indicators for the lung and the heart health. Even for those young colleges, students, graduate students, we can see those things, of course. This is a preclinical thing, so unless you understand science, you probably don't feel there is effect. But one study I have done in Shanghai with a group of children suffering from asthma, and I talked to a clinician, they take care of this kid. They said, I really think living in Shanghai, living in China with the high levels of air pollution, if you want to help your patients, I think we should convince them to use HEPA filters. The clinicians, it's kind of friends, says, oh yeah, can we generate publishable papers? I said, yeah, I think so. Because she was not really, from the beginning, convinced this thing is going to help. Because she's prescribed drug or whatever. I said, oh, I tried very hard to improve the deep lung, the small airway health with the steroids, all those things. Says this is very difficult to do because, just the inhaled droplets, this doesn't go that deep. But I said, well, those particulates that everybody's inhales every minute, every second, can deposit down there where science tells us that's where they can cause inflammation, that sort of thing. If we get rid of that, their small airway inflammation probably will be lessened or improved, right? So anyway, I convinced the physician team to collaborate with us, and we did a trial. Mike Bergen is there, my colleague from Duke. We set up those monitors, that kind of things. At 2 weeks intervention, that the physician saw some clinical indicators, says, well, my drug targets to improve this indicator by 20%. Guess what? Those 2 weeks HEPA filter improved that indicator 35%. She said, oh, now I'm going to tell all my patients to use this. Anyway, that later I saw my colleagues in University of Michigan did a 2-week trial in senior homes in Detroit. You know, they measured vascular function, they measured pulmonary function, seeing all significant improvements. So that's really got us to work with Zhang, Frank, and the USA team. We said, we really now need to do a longer-term trial, because short-term trial, we all know, you know, people will use this probably more, you know, have a better compliance, whatever, or just easy to follow, right? I bought an exercise machine at home. For the first month, I actually used them. After a while, I forgot there's benefit this, you know, device in my home. So what happens to the air purifier? If you put it in the home, really have a long-term use, we believe pathologically is going to really improve the chronic inflammation, right? That will be a good thing, but whether people are going to really have a habit, right, to use it in a sustainable fashion, we don't know. But so I really very much I want to thank our participants. You committed to 6 months or 9 months per session, right? Plus the washout. So long term, that's a big commitment. So you're committed to this work, and scientifically we will know really how long-term use of the HEPA air purifiers improves the health outcomes we're looking into, right? Either metabolic outcomes or cardiovascular outcomes. We're assessing those 2 studies. So you are making a big contribution to science. If we find these insights, we will try to learn what really makes this intervention work, what other things we can do to improve the efficiency. I think that would be a big contribution to the society, because this could be a simple, easy way, but have a big health benefits. So with that, I really, just to tell a story, myself is convinced, I will use HEPA purifier for the reason that I told you. My problem is the allergies, but overall the health, right? If we're having asthma, we're having metabolic disorders, we have a cardiovascular health concerns, just based on what the pollutants can do to damage our health, and this technology is going to reduce that exposure. It will make a difference. So with that, thank you so much again, and I hope that at some point you will be happy with the result we get from this study, and this whole thing will improve your health as well. Thank you so much.